All right. Hi, everyone. My name is Jessica, and for Module 5's discussion, we'll be going over delirium versus dementia. So first off, we'll talk about dementia. In this first slide, I'll be comparing delirium versus dementia. With delirium, there's usually a sudden onset which occurs within days to weeks. It's usually an acute problem, and it is most of the time preventable and reversible. It usually affects the patient's attention and awareness. There are two types of delirium, which includes hypoactive and hyperactive, and it requires urgent evaluation and treatment, and it's often done inpatient. For dementia, there is a progressive onset, which is months to years. It's a chronic problem and it's not reversible. It affects the patient's memory. There are many types, such as Parkinson's, Alzheimer's, Lewy body, among others, and it requires an in-depth evaluation and gradual treatment, and this is often done outpatient. Some similarities between the two include confusion, agitation, and hallucination. Patients with dementia or delirium can be seen having these symptoms, and then both ailments affect a high number of older adults. So I chose to talk about Lewy body dementia. The cause of this is a buildup of protein in the brain that forms clumps called Lewy bodies that settle in nerve cells, and these protein buildups are also associated with Parkinson's disease and Alzheimer's. Risk factors include age. People over 60 are more likely to develop Lewy body dementia, and males are more likely to suffer from it than females. Family history of Lewy body dementia also increases chances of suffering from it. Symptoms include visual hallucinations, movement disorders like the one seen in Parkinson's dementia, autonomic dysregulation, so sometimes they're unable to control their blood pressure or they'll sweat profusely, cognitive decline, and sleep disturbances. There's currently no treatment, but there are medications that can be used to help with symptoms associated with the disease process. Some warning signs of dementia include forgetfulness, especially with recent events or common words, difficulty with common tasks like cooking and cleaning, becoming lost in places that are familiar to them, poor judgment, especially with finances, misplacing objects in unusual places, for example, clothes in the bathtub, changes in mood, behavior, or personality, and then a lack of interest in life activities. There are 3 stages of Alzheimer's. These include mild, moderate, and severe. In the mild stage, some memory loss is seen. The patients often get lost in places that are familiar to them. They have difficulty with normal tasks such as chores and difficulty managing finances. They often make bad decisions, are less talkative, and are more moody or anxious. In the moderate phase of Alzheimer's, the patient experiences increased confusion and a short attention span. They often have difficulty with language or numbers and reasoning. They are often unable to learn new things. They tend to become restless and wander, especially in the afternoon and evenings. This is known as sundowning. The patient also tends to repeat themselves and repeat the same phrases over and over. They may experience hallucinations and paranoia, and they may also be impulsive and have a hard time completing their ADLs. In the severe phase of Alzheimer's, noticeable weight loss is seen. Some patients may experience seizures, but this is not seen in everyone. The patient may also experience dysphagia and garbled speech. They may become more incontinent of bowel and bladder, and they may also not be able to recognize their family anymore. Finally, in late stages, contractures may be seen. There were 3 different medications discussed in the book that can be used to help manage the symptoms of dementia. These include aducanumab, cholinesterase inhibitors, and NMDA receptor antagonists. Aducanumab was the first drug approved to remove amyloid plaques from the brain. This medication was recommended for patients in the mild stages of Alzheimer's disease, but it was discontinued November 1st of 2024. There are other medications in the same family available to help treat Alzheimer's. Cholinesterase inhibitors increase the amount of acetylcholine in the brain, while NMDA receptor antagonists help to protect neurons. These medications are used for symptom management, and the patient often has better results than if they were not on any medication. Cholinesterase inhibitors are approved to be used in the mild to moderate stages of dementia, while NMDA receptor antagonists were approved to be used in the moderate to severe stages of dementia. Both of these medications can be used in conjunction with one another. Once the patient progresses to the severe stage, it is hard to control symptoms, and they may experience side effects that make it necessary to discontinue these medications. The Beers list is based on criteria that outlines medications that should be avoided in older adults. There are many medications that the Beers list recommends to avoid in adults with dementia. These medications tend to increase confusion and worsen their cognitive function. All right, in our next section, we will talk about delirium. Many factors can trigger delirium. A few of these triggers can include loss of time for the patient, uncontrolled pain, electrolyte imbalances, and sleep deprivation. Warning signs of delirium include agitation, anxiety, disorientation, and urgent calls for attention. There are many medications that increase confusion and contribute to delirium. Some of these include analgesics, muscle relaxants, benzodiazepines, antiemetics, and anticonvulsants. Delirium is often seen in critically ill patients in the intensive care unit, but on other units in the hospital as well. Research has shown that there was a significant increase in morbidity and mortality in patients who experience hospital-induced delirium versus patients who do not. Length of stay in the hospital often increases for patients who experience delirium, and they are more likely to die because of delirium, whether it's for a direct or indirect reason. And then some patients are unable to fully recover from their delirium. Preventing delirium is one of the most important interventions for patients in the acute care setting. If a patient starts exhibiting signs of delirium, it is important to examine the underlying causes and adjust their care as needed. Many times, non-pharmacologic treatment is preferred, but pharmacologic treatment may be needed. If delirium is caught quickly, it can be reversed, but in some cases it can have long-lasting cognitive effects that are irreversible. Two common problems observed in delirious patients are inattention and sleep disturbances. Frequent observation is needed for patients who are suffering from inattentiveness. They often forget to call appropriately and are at great risk for falls or injuries. Giving these patients simple math problems or simple tasks, such as folding laundry, may help increase their attention span, and family involvement is key in increasing their attention span. Another common problem is a disturbance in their sleep-wake cycle. Many patients become confused and sleep during the day and stay up at night. This greatly contributes to their delirium. It is important to allow sunlight in the room, especially in the morning, and provide darkness at night. These two interventions help patients keep their sleep schedule regular. Another intervention to help improve their sleep disturbances is to ambulate the patient to the chair for every meal. Finally, we'll talk about the relationship between dementia and delirium. A patient with dementia is more likely to develop delirium than a patient who does not have dementia. The primary role of the nurse in patients with dementia and delirium is to provide a safe environment for the patient. It is important to ensure that the proper fall precautions are in place to prevent further injury. It is also important that the nurse knows the signs of delirium and is able to identify it so that the proper course of action can be taken to increase the likelihood of a favorable outcome for the patient.